In today's video, I'm going to be telling you why you shouldn't get ACL surgery just yet. And if my own sister tore her ACL today, I would be telling her not to get ACL surgery. I'm Tilly Milverton. I'm an ACL specialist and general knee rehab specialist. I've had 4 knee surgeries of my own, one of them being ACL surgery. And in today's video, this is something that I literally wish all ACLers knew before they go under the knife to get ACL surgery. Unfortunately, I'm on the receiving end of a very sad side of ACL rehab where a lot of the time I spend my day picking up the pieces from people that's had ACL surgery and being spat out of the system that really isn't a system, because there is no system when you have ACL surgery, but you've been spat out of it, not knowing what to do, completely lost. You've had a surgery that you didn't even know would impact your life as much as it has, and now you're just in turmoil. And it's generally me left to pick up the pieces. So who actually needs to get ACL surgery? Because most surgeons will tell you you need surgery because they are a surgeon. They spend their whole entire day in theatre, right? There are surgeons like Mr. Paul Tricker who will do his utmost to not operate, right? He goes for non-operative management. He works closely with rehab specialists like myself and others, where it's our job to save people from having surgery. And that's exactly what he does. However, there is a set amount of people who definitely need surgery, and then there's definitely a set amount of people who do not need surgery. What you need to do before you get a surgery is understand which party are you from. So who definitely needs surgery, right? Who cannot progress and cannot live without an ACL? Now, realistically, lots of therapists, lots of surgeons will have arguments about this, but what you have to look at it is you have to look at this situation with a lot of common sense. So let's say, for example, let's say my nephew, okay, he's 14, he plays lots of sports, all different types of pivoting sports. If he ruptures his ACL tomorrow, I'm sending him straight to Mr. Tricker to get a new ACL put in his knee. Okay, we'll do prehab, we'll quiet the knee down, he'll have full range of motion, then he is going to have ACL surgery and I'll manage him and his expectations accordingly. Because if somebody like Taylor, my nephew, didn't get ACL surgery, his knee is going to be wobbly, giving way. He doesn't have the neuromuscular control. At 14, you just don't. It's not possible. Great big rugby players can play without ACLs because their legs are massive and they've got years of experience. But for Taylor, his knee is at risk of giving way. And when it gives way, in a large giving way episode, we can actually take things like the meniscus, lateral and medial with it and cause other damage in the knee as well. So he's definitely a candidate. Somebody in their mid-20s who perhaps just mountain bike or like going for a walk with their dog. They don't particularly do anything that really requires them to pivot. They hurt their knee, say, playing netball, but they say, actually, I don't really know why I played. It was a one-off. I'm never really going to do any pivoting sports again. I don't want surgery because most people don't want surgery. Then actually that person is a really good candidate for coping. Can we cope? They would start a prehabilitation program with somebody like myself and under the care of an expert. And we would try to determine how steady is that knee. Is it stable? You know, we would have the MRI scan, we would have a surgical opinion, of course, but ultimately, what can they manage to do day to day where that knee remains quiet and that knee remains nice and happy? And then you just evaluate it. But let's say another example is somebody in their 30s that is super active, that plays a lot of sport, goes to the gym regularly, has an ACL tear, and actually their knee's quite unstable. It's giving way day by day or every other day or even weekly. They walk their dog and they twist and turn and the knee gives away. They're probably not going to cope very well without an ACL and they probably need a new ACL. So as you can see here, we try to determine who's going to cope without and who won't cope without. But there are situations, and I've been put in situations where I've got lots of patients who come to me and say, I do not want ACL surgery, but I've got an ACL injury with an MCL injury and a meniscal injury. Now, that is very tricky, and I need a surgical opinion, and I sit down with that patient and I explain very, very clearly, because you have a meniscal tear, your knee is already going to be unstable, or it can be unstable, and your ACL is not intact. Your MCL is healing, so you're going non-operative, which is fine, but there are risks, quite high risk involved with this, and the level of stability we may regain post rehabilitation might not ever meet your expectations. But I've got patients that have got back to cricket, got back to ultra running, and they've just come to me and said, Tilly, I had an operation on my knee a few years ago. My dad's had surgeries. It's never worked. Like, it's not for me. These people don't not want to work hard. They're not trying to skip steps. They're just saying, I don't want to go under the knife. I don't want major knee surgery where the outcome isn't guaranteed. Because I think a lot of people forget that when you have ACL surgery, the outcome isn't always guaranteed. Just had to double check that my mic was actually working. The outcome's not guaranteed. If you don't do the work, you're not going to get the results that you think. You can't moan about not getting the results for the work that you didn't do. So then you come to, you know, people that's much, much older, that's probably never going to use their ACL. They're not going to be active enough to have any instability episodes. They're definitely going to cope fine without an ACL, okay? But multi-ligaments, meniscal injuries, mainly aiming for that surgical route unless they're really adamant they really don't want to do that, that's absolutely fine. And then younger category people that do pivoting sports, that do explosive sports, they're probably going to be a candidate for ACL surgery. But with all of these patients on both sides of it, rehab is going to be key. And the biggest mistake, and this is why I think most people that have ACL surgery just shouldn't have it, is they get the surgery, they have no idea what surgery they've had. Now, I work with, obviously, Mr. Paul Tricker, who's an incredibly good surgeon. He communicates far, far superior than a lot of other surgeons. But I do know other surgeons that do explain the surgery. They do say, this is major knee surgery. We're doing it for this reason and you'll get the benefits for this, but rehabilitation is key. You need to move your knee, you need to get going, you know, recommend this ice machine, whatever. I don't believe when patients say, I had no idea what surgery I was getting, because even if you left that consultation, you can research, you can ask, you can figure out the type of surgery you're having and actually understand that you're getting major knee surgery. So if you're just going to have the surgery and not have a clue about it or anything like that, don't get it. You need to actually invest and educate yourself. And also, there are people that get the surgery and they think that they've had, like, I can't even pick or come out with a word to describe it, but there are people that genuinely don't make it upstairs after they've had ACL surgery. And I can't quite fathom that. And you might be watching this, you might be one of those people, I'm not sitting here to offend you, but, you know, it's ACL surgery. You've had a new ligament in your knee. You need to get moving. You need to get going. Yes, it's painful. I've had 4 knee surgeries. My knee is degenerating. I'm probably heading towards knee replacement, like, you know, in years to come. I totally get the impact that this has on your life, but equally, you can get up a set of stairs. You can use one leg. You know, people break their leg and are in a cast for 6 weeks and they get upstairs. The attitude that you come out of that surgery with, for me, you can almost just set off on the wrong stepping stone. You don't want to do rehab. You are happy to just guess your exercises. You sign up to a Facebook forum where you just ask other exercises off other people rather than actually investing your time and your finances. I think if you're having major knee surgery and you say, I can't afford rehab, I just don't think you should have had the rehab, because we're all off work. I was off work. The quicker I got back to full fitness, the quicker I get back into my clinic. You know, that should be the mentality that we're working towards. Most people can go back to a normal desk job by 2 weeks, and yet some people are on sick until 6, 8 weeks, working from home, still on crutches at 6 weeks, 8 weeks, 12 weeks. That isn't normal. I know everybody has different pain thresholds, but you must educate yourself in readiness and set those expectations at the start of your surgery that actually, no, that's not normal. Because I'm really sad to say that the normal ACL surgery is going that people don't get full extension, people don't get full flexion, people aren't coming off crutches, people aren't making it upstairs to their bed, people are having 12 weeks off work. You know, you've got to understand the surgery that you're having and appreciate that, yes, it's major knee surgery, totally get it, but you have to work hard. A lot of people get their surgery and just blame the surgeon, and yet they've sat on the settee for the last 6 weeks and done nothing. By 2 weeks, I was out about walking normally. My patients are all the same, and you can't just say that that's luck. You can't just say, oh, you know, everybody's different. Yes, everybody is different, but it's not a big task to ask of people just to get on with their rehab and do it 4 times a day, the right exercises at the right time. Trust me, your rehab will absolutely fly. The people that's now purchasing my ACL recovery guide and messaging me, and they're like, people around me cannot believe how well I'm doing, all because of your guide. Like, it's not luck, it's not coincident. Like, these people are investing £89, they're investing their time, and they're getting the rewards for it. They're back in the gym early. And then there's the other side of that flip coin of the people that probably should have never have had ACL surgery, that just don't want to commit to this. They had no clue what they were setting themselves up for, and now they just want to guess themselves through it, or unfortunately just have a pity party and just give up and just, you know, think that this is the only worst thing that's happening to them in their life, and they can't see a way out of it. And it's so sad. It's so sad to see. My Instagram DMs and Facebook is absolutely full of people that don't know what to do and when to do it, and they openly say, I wish I never had this surgery. I just think hopefully maybe somebody will watch this that's about to have ACL surgery and will go, actually, have you got the next 12 months of your life to commit to this rehab? You know, it is hard to gain muscle mass, to pass the strength testing, to return to sport safely. You have to eat more calories. You have to go to bed on time. You have to get into a routine that you're probably not going to enjoy every day of the week. You have to recover properly. You know, it is really difficult, okay, to go through it, but is 10 times harder if you don't equip yourself knowing what to do at the right time. And now there's so much information out there that you really can help yourself if you choose to. My YouTube, my Instagram is full of free tips and advice, yet people still message me, say, I can't get past 110 degrees at 10 weeks post ACL surgery. Have you got any tips or tricks? Just use your eyes. My page is absolutely full of them. I think ACL rehab is difficult, but I think a lot of people are making it very hard for themselves by being totally unaware of the surgery you're about to get and relying on Google and TikTok and Instagram to guess your way through rehab, or being the Facebook ACL recovery groups where people just share exercises, ask other people if they think their wound's infected. If you think your wound is infected post ACL surgery, you need to go straight back to the hospital, because if you get a bone infection, it's game over. Like, you're talking serious complications. I've seen people even asking there, do they think that they've got a DVT, a life-threatening condition? They're asking in a Facebook group. You know, you kind of have to evaluate the severity of what it is that you're going through and actually take the correct actions towards improving your own recovery. That ultimately lies within you. It's up to you to find a good physio. It's up to you to actually do the exercises. And then you can't moan for the work that you have. You can't moan if you don't get the results for the work that you haven't done. I hope this video doesn't come across really harsh, because it's really not in my nature, and I'm the most empathetic and sympathetic therapist you will meet. My patients will tell you, I will deep dive, we will get emotional in sessions. I know how tough this journey is. I've been through it, and it was incredibly difficult for me. I had ACL surgery with LET. I had a big chondral D-flap at the back of my knee removed, that is still, you know, obviously, unfortunately, degrading. I've not had an easy journey, trust me. But equally, I think your own rehab is down to you, in order to you to get on with it and just do it with the right therapist, the right equipment. You will get back to the sport that you love, but really consider getting ACL surgery, because if you don't want to even do prehab, you will not enjoy rehab. It is difficult. Every day you have to turn up. You know, everybody now in the summer, we're now in, you know, July 2025, everybody now is getting ready to ski in February. You are starting those preparations months and months in advance. If you're not prepared to do that, if you're not prepared to do the work, and you're just going to sit at home, lay on the settee, scar tissue will build up, or can build up. I'm seeing more and more people with scar tissue, and I'm not blaming surgeons. People are so fast to point the finger at surgeons, but it's patients who sit there and don't move for the following 6 weeks and just watch Bridgerton or Breaking Bad, and unfortunately complications do happen. But please take this video and really evaluate if you're about to get ACL surgery and if you truly need it or you can live without an ACL, and if you're truly ready for the rehab, what's about to come your way. If you want a complete ACL recovery guide, there is quite literally my ACL recovery guide. I built it because I'm way too busy to work with people one-to-one and answer all the questions that I get routinely in my DMs. And a lot of people have no idea what the rehab should actually look like, and it's making it 10 times harder. So it's a complete guide, £89. Once you buy it, you get access to me for any questions or any queries. And I promise you, I care so much. And that's why I've made this post, because maybe it might just be that eye-opener that perhaps one of you just might need. But I hope you've enjoyed this video, and I will catch you in the next one.